Let's continue. Several factors contribute to the regulation of arterial blood pressure. Short-term regulation depends on the nervous system and hormones by changing peripheral resistance and cardiac output. Long-term regulation alters blood volume via the kidneys. First, let's talk about short-term regulation by neural factors. Neural controls alter both cardiac output and peripheral resistance. Most neural controls operate via baroreceptor reflex. These reflexes are integrated in the cardiovascular center of the medulla, and their output travels via autonomic fibers to the heart and vascular smooth muscle. Occasionally, impulses from chemoreceptors and higher brain centers also influence the neural control mechanism. The baroreceptor reflex is by far the best known neural mechanism for arterial pressure control. Baroreceptors are extremely abundant in the wall of the carotid sinus and the aortic arc. They are stimulated when stretched. For example, when arterial blood pressure rises, baroreceptors are stretched and activated. Impulses are sent to the cardiovascular center. Vasomotor and cardioaccelerator centers are inhibited, while the cardioinhibitory center is stimulated. Decreased output from the vasomotor center allows the arterioles to dilate, reducing the peripheral resistance. So, mean arterial pressure, MAP, decreases. Decreased signal from the vasomotor center also allows veins to dilate, which shifts blood to the venous system. Therefore, the venous return and cardiac output decrease. Impulses to the cardiac centers inhibit sympathetic activity and stimulate parasympathetic activity, reducing heart rate and contractile force. As cardiac output reduces, so does mean arterial pressure. The same is true when blood pressure decreases suddenly. A decline in mean arterial pressure initiates reflex vasoconstriction and increases cardiac output, bringing blood pressure back up. In this way, adjustments in peripheral resistance and cardiac output help minimize big fluctuations in blood pressure. Rapidly responding baroreceptors can protect the circulation against acute changes in blood pressure. However, baroreceptors are not effective in sustained pressure changes. In patients with chronic hypertension, the baroreceptors are adapted to monitor pressure changes at a higher set point. The baroreceptors do not see the elevated blood pressure as abnormal. In such cases, the hypertension will not be corrected by the baroreceptor reflex, and the high blood pressure persists. Hormones also help regulate blood pressure, both temporarily where changes in peripheral resistance, and in long term through changes in blood volume. In situations like prolonged stress, the adrenal gland releases epinephrine, adrenaline, and norepinephrine. Both hormones enhance the sympathetic response by increasing cardiac output and promoting generalized vasoconstriction. Therefore, blood pressure is elevated. When blood pressure or blood volume is low, the kidneys produce renin. Renin acts as an enzyme, ultimately generating angiotensin II, which stimulates intense vasoconstriction, promoting a rapid rise in systemic blood pressure. When the arterial walls are stretched by high blood pressure or blood volume, atrial natriuretic peptide, ANP, is secreted by the atria. ANP promotes excretion of sodium and water from the body, leading to a reduction in blood volume and blood pressure. Antidiuretic hormone, ADH, also called vasopressin, stimulates the kidneys to conserve water. It is not usually important in short-term blood pressure regulation. However, when blood pressure falls to dangerously low levels, such as during severe hemorrhage, much more ADH is released and helps restore arterial pressure by causing intense vasoconstriction. Hence, its other name, vasopressin. Renal mechanisms mediate long-term regulation by changing blood volume. Although total blood volume varies with age, body size, and sex, renal mechanisms usually keeps it close to 5 liters. The kidneys act both directly and indirectly to regulate arterial pressure and provide the major long-term mechanisms of blood pressure control. First, let's see how direct renal mechanism works. The direct renal mechanism alters blood volume independently of hormone. When either blood volume or blood pressure rises, the rate at which fluid filters from the bloodstream into the kidney tubules speeds up. In such situations, the kidneys cannot reabsorb the filtrate fast enough, and more of it leaves the body in urine. As a result, blood volume and blood pressure fall. When blood pressure or blood volume is low, water is conserved and returned to the bloodstream, and blood pressure rises. Through indirect means, the kidneys regulate blood pressure via the renin-angiotensin-aldosterone mechanism. When arterial blood pressure declines, blood renin level rises. Renin catalyzes angiotensinogen to angiotensin I. Angiotensin converting enzyme, ACE, facilitates the conversion of angiotensin I to angiotensin II. Angiotensin II stabilizes arterial blood pressure and extracellular fluid volume by directly constricting blood vessels and promoting secretion of aldosterone and ADH. These agents regulate blood pressure in the long term by enhancing blood volume. Now, let's come back to the story of Mrs. Lin. Her left renal artery is stenotic, which leads to significant reduction in renal blood flow. Her left kidney thinks that arterial pressure is low, thus activates renin-angiotensin-aldosterone system. Therefore, her arterial blood pressure is elevated. Her poor renal function is most likely caused by the long-standing hypertension. As the name suggests, ACE inhibitor reduces the production of angiotensin II to allow more vasodilation. Thus, Mrs. Lin's blood pressure would be reduced. In summary, arterial blood pressure is the product of cardiac output and total peripheral resistance. It is carefully monitored and maintained at a normal mean level of about 100 milliliter mercury. The baroreceptor reflex is effective in response to acute changes in blood pressure. Short-term regulation depends on the nervous system and hormones by changing peripheral resistance and cardiac output. Long-term regulation alters blood volume by involving the kidneys. The kidneys act both directly and indirectly to regulate arterial pressure and provide the major long-term mechanisms of blood pressure control. It is therefore also a target for therapeutic intervention. That's all for Chapter 5. Thank you very much for joining us.